The journey of motherhood. A woman's journey reaches glory through motherhood. To comfort her beautiful journey, she is in need of great care and support, both mentally and physically. Use of enema during labor provides support and comfort to the mother. Enema helps to avoid fecal incontinence, which usually prevails due to birth canal compressions. It also helps to prevent probable fecal contaminations of the sterile delivery field. Enema is needed in the early stage of labor, the reason being the hormones that contract the uterus during labor often stimulate the intestines to contract, thereby causing propagating bowel movements. This can lead to fecal soiling. To prevent these unfavorable situations, enema administration helps to expel the fecal contents well in advance before the start of labor, thus making the patient more comfortable and the sterile labor area clean. Enema administration during labor and delivery is prevalent in India and is still a common practice in many government and private hospitals. This is possible because of the healthcare professionals who support the use of enemas, as they believe that enema decreases the length of labor, keeps the delivery field free of fecal matter, and prevents neonatal postpartum infections. Currently available enemas are broadly classified mainly as phosphate enema, mineral oil enema, saline solution enema, and soap water enema. Conventional enema preparations are time-consuming and may cause discomfort to women. It also increases the workload on wards. Also, watery feces due to inadequate or inappropriate enema may increase contamination, potentially increasing maternal and neonatal infections. Phosphate enemas are hypertonic solutions, and their retention can lead to a massive absorption of sodium and phosphate in the colon, which can lead to severe electrolyte disturbances. Moreover, a phosphate enema may not be appropriate in certain circumstances, such as constipation above the splenic flexure, paralytic ileus, frail patients, patients with an electrolyte imbalance or cardiac arrhythmias, and patients with recent rectum surgery.
I'm going to talk about the role of an enema in a pregnant patient who is to undergo labor. Either she has come in early labor or we are inducing labor. Enema was a very essential component in induction of labor. However, if a patient has a loaded rectum, has been constipated, then having the rectum evacuated gives her a great sense of relief. And for that, various enemas have been used in the obstetric practice from time to time. Enemas like soap and water enema, which the nurses made in the hospital only, or it was a mineral oil enema or phosphate enemas. So all these enemas were used from time to time with complications also and side effects. So now is the time to upgrade even our enemas. And Lactulose, US FDA approved also, and has been found to be safe to be used in pregnant women as well as in laboring. It is an osmotic laxative, which is composed complex sugar, which tends to pull water in the rectum out into the rectum and hence works as a stool softener. To check the records of the patient, make sure that this is the right patient, and you're not mixing up with patients, the one who has to get the enema. That explain the procedure to the patient, tell her what you're going to do, relax her, talk to her, take her into confidence. That take the patient into a room where she's comfortable, or draw a curtain of a bed so that she feels that she's got full privacy and is comfortable. The best position to administer this enema is the left lateral position. And put the patient in left lateral position, ask her to draw the right leg flexed from the knee towards her tummy, and that should be a very good position to administer the enema. Once we put the patient in the left lateral position and she's comfortable, it is important to keep a bedpan close to her. Put a sheet under the patient so that if any enema or fluid spills out, it doesn't soil her bed. And then we take out the enema tube.
Bend the nozzle tip till it breaks.
And lubricate the nozzle about 4 inches. Examine the patient rectally. We find that there is nothing which stops us from giving enema. There is no chance of injury to the rectal mucosa. We put the nozzle into the rectum, insert it for about 3 to 4 inches, pointing towards the umbilicus very gently. Once we've inserted it deep enough, then we push, release the lock of the nozzle, press the enema back, and the whole content is emptied into the rectum. We pull the tube out gently and let the patient rest for a couple of minutes, maybe half an hour.
Lactulose offers good therapeutic benefit, especially for women right from pregnancy to postpartum constipation. Lactulose is the gynecologist's #1 choice. Trusted over 6 decades. Aron, a division of Intas Pharmaceuticals Limited, proudly introducing for the first time in India LOOZ Enema Mini, the original ready-to-use lactulose enema
for proctoclysis.
In constipation during labor and pelvic surgeries, upgrade to LOOZ Enema Mini, the original ready-to-use lactulose enema. LOOZ Enema Mini scores over phosphate enema, as LOOZ Enema Mini is effective and safe from pregnancy to postpartum constipation. Moreover, a pre-launch survey with 2,720 patients revealed that 98.5% of gynecologists were found satisfactory. Upgrade to LOOZ Enema Mini. Thus, LOOZ Enema Mini upgrades the patient's labor journey comfortable with care. LOOZ, with 20 years of clinical expertise, providing comprehensive therapy in constipation management. Satisfied and trusted by over 43,000 medical fraternities. Moreover, LOOZ, the smart laxative, has gained more than 25 million satisfied experiences. In an endeavor towards constipation-free India, Intas Aron presenting LOOZ and now LOOZ Enema Mini exclusively for patients to upgrade during labor and pelvic surgeries. Thank you.